Allevant, a joint venture between Mayo Clinic and Select Medical, is a proven solution for critical access hospitals searching for new models of care that will better utilize existing capacity and will significantly improve short and long-term viability in uncertain times. The average daily census across the country in critical access hospitals is just over 4, and many critical access hospitals are struggling financially. Allevant's experienced team can substantially increase patient volumes and margins in 90 to 120 days. Allevant's Transitional Care Program is based on a successful Mayo model established in 11 critical access hospitals in Minnesota, Wisconsin, and Iowa. Allevant's Transitional Care Program improves outcomes and promotes collaboration rather than competition with acute care hospitals. There are over 1,300 critical access hospitals that provide essential medical care to rural communities across 46 states. Each critical access hospital maintains 25 or fewer beds and directly contributes an average of 204 jobs to the local economy. Rural healthcare is in critical condition. Rural residents have access to fewer healthcare services, lower economic and insurance status, fewer physicians per capita, and higher chronic disease rates than their urban peers. Maintaining long-term viability of critical access hospitals will be essential for rural healthcare delivery. Nearly 20% of Americans live in rural communities, yet fewer than 10% of physicians live in those same communities. Critical access hospitals make up nearly 30% of acute care hospitals, but receive less than 5% of total Medicare payments to hospitals. Although Medicare pays critical access hospitals 1% above the cost of providing care, critical access hospital revenues from other payers often don't cover costs. Across the country, there are underutilized CAH beds and talented rural healthcare teams looking for opportunity and new models of care. Fortunately, an innovative post-acute care model has been developed that creates a new niche for CAHs and provides a desperately needed solution to address present gaps in our healthcare system. The model of Allevant is based on the successful Transitional Care Program at Mayo Clinic, which provides access to needed post-acute services in rural communities. The Transitional Care Program at Mayo relieved the bottleneck of patient flow in acute hospitals and utilized the existing capacity in critical access hospitals. As a result of the program, referrals from Mayo Clinic to critical access hospital transitional care increased by over 500%. Transitional care patient days increased by 200%, and respiratory patient days increased 800% in just a 3-year period. The Mayo Transitional Care Program successfully expanded to 11 critical access hospitals in Minnesota, Wisconsin, and Iowa. The Transitional Care Program established high-quality post-acute care pathways for patients who no longer required acute care, but needed additional nursing and therapy support prior to transitioning home. This was beneficial to acute care hospitals, critical access hospitals, and most importantly, patients. The financial return on investment for Mayo Clinic was 20-1. Small can be huge. Establishing a transitional care program in an underutilized critical access hospital has numerous benefits, including increasing swing bed utilization and decreased patient transfers, resulting in significant increased revenues and margin, increased patient and staff satisfaction. Patients in the Mayo Clinic Transitional Care Program consistently rated their overall care and willingness to recommend over 90%. Staff satisfaction was among the highest in all of Mayo Clinics. Reducing hospital readmissions utilizing evidence-based best practices. Our team experienced readmission rates in the single digits versus over 20% when compared to other post-acute care programs across the country. This is a key marketing driver for acute care hospitals that are incentivized to reduce hospital readmissions. This promotes collaboration rather than competition. The experts anticipate that a high percent of the over 1,300 critical access hospitals will be struggling financially without pursuing new strategies, new revenues, and new ways to increase utilization of existing capacity in underutilized critical access hospitals. Allevant's Transitional Care Program has a proven track record at creating short and long-term success. Allevant's experienced team brought together from Mayo Clinic and Select Medical will provide a detailed gap analysis and on-site implementation for your new program to start quickly, a comprehensive quality and patient safety program, extensive multidisciplinary clinical training and learning management system, quality database management for patient outcomes and reporting, plant, supply, and equipment recommendations, telehealth clinical support, and a data-driven marketing and referral education solution. Thought leaders and experts see the value of Allevant's model. Terry Hill, MPA, Senior Advisor for Rural Health Leadership and Policy for the National Rural Health Resource Center, comments, critical access hospitals planning to cross the shaky bridge between one payment methodology to another should be able to find value in this innovative model, both now and in the future. Jerry Wilborn, MD, National IPC Director of Post-Acute Care, comments, Allevant's emphasis on establishing high-quality post-acute care pathways, implementing evidence-based best practices, and providing a template for critical access hospitals to implement programs that have a proven track record and also positively impact financial health for those facilities is a model that demonstrates significant promise. John Carnegie, MD, Director, Carnegie & Associates, LLC, and author of Designed to Adapt, Leading Healthcare in Challenging Times, comments, Allevant Solutions offers exactly what U.S. healthcare needs, more and better care for patients and families at continually lower cost. Allevant's model can generate significant financial opportunities for critical access hospitals. By entering information from your most recent cost report, Allevant's model has shown annual revenues over $1 million with margins between 15 and 35%, with an increase of just 1,000 bed days per year, or less than 3 average daily census. Please contact us if you are interested in receiving our white paper. You may also request our financial template, which will allow you to enter your recent cost report information to see how this program will benefit your critical access hospital. Thank you.